tobacco control policy in Malaysia has evolved significantly over time, initially starting in the 1980s with the measurement like health warnings on cigarette packaging and advertising restriction. Malaysia ratified the WHO Framework Convention on the Tobacco Control in 1915 to align with the global standard. The policy has seen and comprised initiatives such as restriction on tobacco advertising, promotion, and sponsorship, alongside implementing graphic health warnings on the cigarette packaging. Amendments have been made to strengthen the regulation and introduce the new measure to reduce tobacco consumption. Collaboration with the government agency and NGO have been vital in creating a comprehensive framework to address tobacco-related issues effectively. Milestone: the introducing graphic healthy warning, implementing smoke-free policy, and the monitoring tobacco use prevalence have helped in the reducing smoking rate and fostering a healthier environment. The policy continues to adapt to new challenges and evidence-based practice to provide a smoke-free Malaysia. The first part of the presentation is the policy problem. There are three policy problems or requirements government to implementing this policy. The first one is increasing adult female involvement in tobacco use. The second policy problem is the majority of the teenagers and students use the various forms of tobaccos. And the third policy problem is the disadvantage of tobacco use, which are highly likely to lead to death. The first policy problem is increasing adult female gender involved in the tobacco use, which data from the Global Adult Tobacco Survey (GATS) conducted in Malaysia in 2011 provide an overview of the prevalence of tobacco use among the adult women. According to the survey, only 1.0% of women were current tobacco smokers, which are significantly lower than the 43.9% of men who reportedly being the current tobacco smoker. This shows significant gender difference in tobacco use, with men more likely to smoke than women. Additionally, the survey found that 30.1% of women are exposed to the tobacco smoke at work and 33.3% are exposed to the tobacco smoke at home at least monthly. These findings show that although the prevalence of tobacco among the women is relatively low, however, ensure to cigarette smoke is still concern because it's increasing over time. Move to the next policy problem. The majority of teenagers and students are various forms of tobacco. Statistics highlight the alarming prevalence of tobacco use among the teenagers and students in Malaysia. According to the Tobacco Atlas, 36.3% of teenagers boys and 4.2% of teenagers girls between the age of 13 to 15 in Malaysia smoke. In addition, the average of age to start smoking at 19, with a significant increase in the number of new smokers recorded daily. Furthermore, of the 2010 National Mobility and Health Survey recorded approximately 15,000 deaths per year due to the smoke-related habit, indicate the severity of issue. Other than that, the Global Youth Tobacco Survey (GYTS) conducted in Malaysia revealed that nearly a quarter of the students now use some form of tobacco, with nearly 1 in 5 currently smoking cigarette and 1 in 10 using other tobacco products. The prevalence of smokers among students is very high, with 30.0% of students having smoked cigarette and 80.2% currently smoking. Additionally, 9.5% currently use other tobacco products and 10.7% of never smoke are likely to start smoke in the next year. Disadvantages of tobacco use, which are highly likely to lead to that, are the last policy problem. The impact of the tobacco use is a major risk factor for the non-communicable disease NCDs, and is strongly associated with the heart disease, lung cancer, and other serious health conditions. The International Agency for Research on Cancer, IARC, officially classified tobacco as a carcinogenic to humans, and more than 80% of lung cancer cases have been directly linked to tobacco smoking. Furthermore, tobacco addiction is a disease or a medical disorder that requires professional treatments and support because nicotine, the main active chemical in the tobacco, is highly addictive. The decision to start smoking may be choice, but the addiction that follows is a significant challenge for the many individuals. This highlights the need of the government intervention to protect people from death and disease caused by the tobacco use. Next is the objective of the National Strategy Tobacco Control in Malaysia. The first objective is maintain smoking prevalence of less than 5% among students aged 15 and above. The second objective is reduce the prevalence of smoking to 15% by the year 2025. And the last objective is to aim reduce the prevalence of smoking to less than 5% by the year 2045.
So we moving on to the strategy by government to control the usage of tobacco. So the first one is to strengthen the existing tobacco control activities. This could include measures such as enforcing tobacco advertising bans, increasing tobacco taxes, implementing smoke-free laws, providing smoking cessation support services, and conducting public awareness campaigns. So the second one is to strengthen the tobacco control activities by using the Empower strategy, which is the monitor, protect, offer, warn, inform, and raise. For monitor, this involves collecting data on tobacco use, prevalence, tobacco control policies, and the effectiveness of tobacco control programs. For protect, it is to implementing smoke-free laws in public places and workplace to protect non-smokers from exposure to second-hand smoke. For offer, providing cessation support services such as counseling and medication to help tobacco users quit. For one, to implementing strong graphic health warning on tobacco product packaging to educate consumers about the health risks of tobacco use. For enforce, enacting and enforcing comprehensive bans on tobacco advertising, promotion and sponsorship to reduce tobacco consumption, especially among youth. Lastly, for raise, increasing taxes on tobacco products to reduce affordability and discourage tobacco use while also generating revenue for tobacco control efforts. So, the third point is empowering communities and enhancing the multi-sector involvement. Empowering communities and enhancing multi-sector involvement involves engaging diverse stakeholders from various sectors, including government agencies, civil society organizations, business, and community groups to address complex issues collaboratively. So the last point is to strengthen the law and enforcement of national tobacco control. It is strengthening the law and enforcement of national tobacco control involves enhancing legislation and regulations related to tobacco use, as well as ensuring effective enforcement of these laws. These may include implementing comprehensive tobacco control policies such as smoke-free laws, restrictions on tobacco advertising and promotion, bans on tobacco sales to minors, and increased taxes on tobacco products.
Good morning everyone. Under the title Strength, let's highlight the success of our policy in keeping the percentage of women aged 15 and above who smoke below 5%. In 2020, female smoking rates in Malaysia dropped to their lowest point in recent years, declining by 0.1 percentage point. This achievement is attributed to our collaborative approach with women organizations, healthcare providers, and community groups. Our policy focuses on reducing tobacco use among females aged 15 and over, excluding e-cigarettes, over the past 2 decades. From 2000 to 2020, we have consistently monitored smoking prevalence among females. With our effort, we have successfully kept the smoking rate below 5%, indicating the effectiveness of our tobacco control measures. Moving forward, we will continue this collaborative effort to ensure a healthy smoke-free Malaysia. Thank you.
Continue with the weaknesses of the policy. The first weaknesses is the National Tobacco Control Policy aims to reduce smoking to 15% by 2025, a target yet to be made due to the prevalence of tobacco use among young people and students in Malaysia. The smoking rate increased by 15.6%, primarily driven by tobacco product use among individuals aged 15 to 19, with 11.6% being active on smokers and 7.5% using vapes, according to the 2019 National Health and Disease Survey. Public ignorance regarding the dangers of smoking persists, with a significant portion perceiving smoking as normal and lacking awareness of its harmful effects, especially among teenagers. Ineffective anti-smoking campaign and the influential tactic of the tobacco industry, highlighted by Malaysia's status as a significant market for illicit tobacco. Further, impaired progress in reducing smoking rates, strengthening the implementation of current anti-smoking measure is crucial before advising to future tobacco control initiatives. The second weakness is the objective of the National Tobacco Control Policy to reduce smoking prevalence to less than 5% by 2045. Faces several weaknesses that hinder its effectiveness. Challenges include inducing widespread behavior change, lack of comprehensive tobacco control strategy like strict regulation on advertising, and the potential influence of unpredictable external factors such as economic fluctuation or emerging tobacco products like electronic cigarettes. Disparities in access to resources and supports for smoking cessation among different population groups further impede efforts to reduce smoking prevalence uniformly. Despite these weaknesses, achieving the goal would reduce the incidence of smoking related to diseases, alleviate the healthcare burden, and lead to fewer premature deaths. Emphasizing the critical need for target interventions to address these challenges and enhance tobacco control measures effectively.
So we're moving on for recommendations for objectives. The first one is to implementing higher taxes on tobacco products. It is increasing tobacco prices is a cost-efficient and effective strategy for lowering smoking rates and promoting public health. Second one is create easygoing campaigns that resonate with their lifestyles and values. It is basically relaxed ads provide a novel and successful way to educate the next generation about the risks associated with smoking in this era of perpetual connectedness and shifting cultural norms. The third one is the youth prevention and education. Youth prevention and education are critical components of tobacco control initiatives because they address the underlying factors that lead to smoking, beginning and provide kids with the information and tools they need to make healthy decisions.
wrap up, our national tobacco control policy has its shortcomings, but it is crucial for controlling smoking rates in our nation. We can't afford to let it vanish instead. Let's focus on modifications. For instance, we should raise the minimum age to purchase tobacco 21 years old, given that currently individuals as young as 18 years old can buy tobacco. In change could significantly impact our effort to decrease smoking prevalence together. Let's work towards a healthier nation with fewer smokers. Thank you.